Right, like bungee. Hey! Oh! Whoa! Hemorrhage mundo!
Less yakking, more cracking, hemorrhage mundo, and send up 2 hams. What? Today we're back at it, breaking down and reacting to the laughable medical scenes and idiotic injuries from The Simpsons. Let's dive right in.
Your spine is more twisted than Sinbad's take on marriage.
I feel like we're missing. That's funny.
That's pretty funny.
There's a big spot where there's a vertebrae missing. I don't know if he injured himself. It also looks like bad scoliosis. If you have really, really bad scoliosis, you actually need to have surgery done. There are other therapies, physical therapy, other modalities that might be quite helpful.
Just give me some drugs and surgery.
Oh, I'd love to, but to be honest, modern medicine has a lousy record of treating the back. We spend too much time on the front.
Well, that is true. I will say that we do our best trying to fix pain that people get in their back.
My back!
But it is really difficult. You have a lot of nerves.
I'm going to send you to my chiropractor.
Hey.
Oh?
I thought real doctors hated chiropractors.
Well, that is our official stance, but between you, me, and my golf clubs, they're miracle workers.
Chiropractors have their place. Emergency medicine doctors have their place. Acupuncturist has its place. All different modalities are good. It's just when you do one all be all and say that this is going to do everything for me, might be a little bit misdirect.
Less yakking, more cracking.
Now, Homer, we don't actually crack backs. It's merely an adjustment. Okay, you're gonna hear a loud cracking sound. There we go.
It feels a little better.
They do feel better. Sometimes there is something that might be a little off and you need to get the correct alignment, so to speak, to allow your body to heal itself. So chiropractors, they focus on nerve flow and that homeostasis of the body and the patterns.
Now, I'll need to see you 3 times a week for, many years.
The body goes back into positions that it is used to. So you get adjusted, but then you have all the musculature and the fascia and the nerves that all say, no, I want to be back in the position that it was. By doing multiple adjustments, you're trying to convince the body, like, no, you got to be back in this position. Careful. Don't want to mix stuff together. All right. That shouldn't mix together. I don't know, all these weird chemicals. Oh, geez. If you mix bleach, Clorox, with ammonia, that actually produces a horrible gas that is very detrimental to you and very, very dangerous. So please don't do that. Oh! Your body weight when you fall is actually quite heavy. You could cause a skull fracture, a cervical fracture of the neck as you extend backward there, and then also the other component of an intracranial bleed that you always worry about. Oh,
She's opening her eyes.
Oh, my head feels like it was punched by a boxing man.
yep.
How many fingers am I holding up?
2.
Very good.
He's holding literally 2 fingers. We see people come into the emergency department with exposure to different types of chemicals. They don't feel well, they're lightheaded, they're dizzy, they're coughing, and we have to try to figure out, okay, what chemicals did you mix together or were exposed to? What type of byproducts could be affecting you and your body?
Now, I have a question.
Yep.
Who are you people?
Oh no, got amnesia. Where am I? This does happen. We see people get traumatic brain injuries and they have amnesia and they can't remember. Sometimes we call it transient global amnesia. Comes on and then actually slowly comes back versus retrograde amnesia where you can't remember anything in the past, but you remember it in the future.
When will Marge remember us?
It's hard to say.
Yeah, you don't know exactly when it'll come back or not. So you just have to kind of bear with people. Sometimes when you have surgery and you're like, oh my gosh, it's already over. What happened? Well, we gave you a medication, typically a class of medicines called benzodiazepines that actually cause amnesia.
With retrograde amnesia such as this, the patient could forget years and years
There
of
you
their
go.
life.
Most of the time in the emergency department, we see it with a lot of head injuries due to like motorcycle accidents or car accidents where people just are repetitive and they're repeating things because they can't remember that we actually asked them and talked about these things.
Marge, I'm gonna take care of you until your amnesia goes scramnesia. I got you flowers, fluffy pillow, and a nice relaxing private room.
You gotta maximize space in a hospital. The hospital that I work at, some of the rooms are semi-private versus private rooms. It actually just depends on the level of care, actually. In the ICU, it's just 1 person per room.
Oh, you're sweet. I'm lucky to have such a kind, uncle. No.
I'm your husband.
Oh, jeez.
What?
I am. We're the same age.
But you're so much more ravaged than I am.
Oh, jeez. Different things can age us. Smoking, drinking alcohol. It depends on how taxed your system is, plus your genetic makeup.
Right, like Bundy. Hey. Oh! Whoa! Hemorrhage mundo.
Hemorrhage mundo. Oh my gosh. Laceration with glass, and then the way the blood is squirting, it looks like arterial. Compress that area, hold it tight, raise it above your heart, get that bleeding to stop.
Hey.
It becomes lightheaded, slipping down to the ground, having a near sinkable episode because he hasn't totally gone out. He could be losing too much blood volume super fast. First of all, I want to say, you see a lot of cartoons with these really sweet bandages on the head like this. I will tell you, from a real life perspective, they're really hard to keep on somebody's head.
Dad, you've been in a coma for 3 days.
They had to feed you through a tube.
That's not how that works. If you do need a feeding tube when you're in the hospital, if it's a short term, you have a nasogastric tube or an oral gastric tube into the stomach, and you can give nutrients that way.
Now, why don't you stay for dinner? It would be my pleasure, son. Send up 2 hams.
That's hilarious. There is a tube system in the hospital.
Tubes.
Where we send like lab work and paperwork and maybe even meds to different areas of the hospital.
Come on, Homer, act all stupid, like you do on TV.
Yeah, come on, dum-dum. Do something unintelligent there.
These guys are enjoying some beverages at the bar. If they're having too much, don't forget, Life Happens. Check it out. Poor Decisions, a supplement that you can take that can help reduce the effects the next day of a good night out.
I'm not your clown. Don't diminish me.
Aww.
Gentlemen, I bid you farewell.
Oh! I mean, it's not funny. That's so dangerous. You have to be careful. Reminds me of Jackass. It can cause strangulation injuries. You can lacerate your vessels of your neck. You can cause compression of your vessels of your neck and decrease blood supply to your brain. A lot of bad things can happen. Or that. Flying through the air, depending on what you hit, a head injury, break a bone, internal bleeding, a lot of different things. So if you came to the emergency department, probably do a CT scan of your neck with contrast to make sure that the vessels are intact and you don't have any tears.
What's he gonna do for an encore?
Ooh, I don't think he'll be doing no encores for a while.
You also worry about swelling of the airway as well. If somebody starts having like a hoarse throat, difficulty breathing, you probably put a breathing tube in sooner than later. The Simpsons, these were hilarious. I haven't laughed like this in a while. Really funny. I hope you guys learned something, maybe learned a tidbit of what to do and what not to do. Also, big new things on the horizon. Check out my brand new supplement company, Life Happens. If you guys enjoyed this, definitely check out this playlist right here. And as always, please make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.